Hey everyone! Welcome back to Milk Matters USA, where we talk all things baby feeding, parenting, and support for new moms and dads. Today's topic is really close to the heart. We're talking about feeding premature babies, what to expect, how to manage it, and tips that can make it easier for both you and your little one. Let's dive in. Clapperboard, Part 1. Understanding preemie feeding basics. So, when a baby is born early, before 37 weeks, their little bodies might not be fully ready for feeding like full-term babies. Some preemies can't suck or swallow properly yet. Others might need help from a feeding tube for a little while. Totally normal. And no, it doesn't mean you're doing anything wrong. It just means your baby needs time and some extra support to get strong enough for full feeds. Clapperboard, Part 2. Breast milk is liquid gold. Breast milk is amazing for any baby, but for preemies, it's basically liquid gold. It's easier to digest, it protects against infections, and it helps their tiny bodies grow. If your baby can't breastfeed yet, don't worry, you can pump and store milk. And if you're struggling with milk supply, you're not alone. Talk to a lactation consultant or your NICU nurse. They're there to help. Some NICUs even have donor milk available, so your baby still gets those awesome benefits. Clapperboard, Part 3. Feeding methods. Let's talk about how preemies are fed. Depending on how early your baby was born, they might start with a feeding tube, called a gavage, then move to a bottle or breast once they're ready. This transition takes time, and every baby moves at their own pace. Some babies will breastfeed right away. Others need practice, and that's okay. Skin-to-skin time, also known as kangaroo care, can really help with this process too. Clapperboard, Part 4. Signs your baby is ready to feed. So how do you know your baby is ready to start bottle or breastfeeding? You'll see signs like waking up more, sucking on their hands, rooting, that little head turning thing, and trying to latch. Your NICU team will guide you, but those are little clues your baby's getting stronger and more coordinated. Just follow their cues and take it one feeding at a time. Clapperboard, Part 5. Tips for successful preemie feeding. Right finger tip number 1. Be patient. Feeding preemies is a journey. Some days they'll eat great, other days not so much, and that's totally normal. Right finger tip number 2. Keep pumping if you're breastfeeding. Pump every 2 to 3 hours during the day, and at least once overnight, to keep your milk supply strong. Right finger tip number 3. Ask for support. Lactation consultants, NICU nurses, feeding therapists, they're all there to help you and your baby succeed. Right finger tip number 4. Track feeds. Jot down how much your baby eats and how they respond. It can help you see progress, even if it's slow. Right finger tip number 5. Celebrate the wins. Every feeding your baby finishes, every extra ounce they gain, that's a step forward. You're doing amazing. Clapperboard, Part 6. When to call your pediatrician. Once your baby is home, keep an eye out for any signs like choking, vomiting, poor weight gain, or not waking up for feeds. If something feels off, trust your gut and call your pediatrician. Better safe than sorry. Clapperboard, closing. Feeding a premature baby isn't always easy, but you've got this. It's all about learning your baby's rhythm and taking it one step at a time. If you found this video helpful, give it a thumbs up, subscribe to Milk Matters USA, and share it with other NICU parents who might need some support. And let us know in the comments, what's been the most helpful feeding tip for your preemie? Baby bottle, you're doing amazing, one feed at a time. See you in the next video.